In my efforts to keep up with the ever-changing landscape of Medicare, I came across this article talking about Project 2025's desire to increase prescription drug costs on 18.5 million seniors. And today I want to dig into it to find out if it's true. My name is Steve Isidore, and this is Summit Medicare USA, where we try to keep you up to date with all of the goings-ons in the Medicare space. As I was reading this article, the first thing that really stuck out to me was this phrase right here. The Heritage Foundation has outlined a sweeping far-right policy vision to put power and profits back in pharmaceutical companies' hands. My biggest issue with that is whenever you call something far-right or far-left, it's already framing how we take a look at what the information is. So what I decided to do was actually go look this up myself, and let me share that with you. So we look here, Project 2025 has an advisory board, and basically their goal is to push a conservative agenda that's stated basically on their playbook. I believe I saw it. Right here, the conservative promise is on their book. So as we look here on page 465, they do have a Medicare reform in that book, which you can access for free on their website. And let's read what the text says. I'm going to use a different document because my eyes aren't as good as they used to be. Medicare Part B reform. The Inflation Reduction Act created a drug price negotiation program in Medicare that replaces the existing private sector negotiations in Part D with government price controls for prescription drugs. So basically, the government can create price controls for prescription drugs because of the Inflation Reduction Act. These government price controls will limit access to medications and reduce patient access to new medication. So they're saying that this is going to limit the access to medications, but nothing has been proven because this really comes into effect next year. So we really will find out in 2025. This negotiation program should be repealed, and reforms in Part D that will have meaningful impact for seniors should be pursued. So basically they're saying we should have a plan after repealing it. And I'm going to take a moment to say, I've watched politics for the last decade and change, and everybody wanted to repeal and replace Obamacare. That's even a slogan. And when they actually had the control to do it, they wanted to repeal it. However, no one had a plan to replace it. So this is very dangerous because if you repeal a discount program with nothing to replace it, it may actually result in higher costs to seniors because we're just going to be going backwards to what things were before. And what was I here? Other reforms should include eliminating the coverage gap in Part D. I agree with that. The donut hole is very terrible and affects a lot of people very negatively. Reducing the government share in a catastrophic tier and requiring manufacturers to bear a larger share. So basically, when people are on the other side of the donut hole, the government kicks in and helps people cover their prescription drugs. That has been eliminated this year in 2024, so there's no longer a catastrophic phase. And then next year, it should be eliminated and brought down to $2,000. But by taking that off of the government, that would make it more of the responsibility of the insurance company, which I don't know if they're just going to go down without a fight. Until the IRA is repealed, an administration that is required to implement it must do so in a way that is prudent with its authority, minimizing the harmful effects of the law's policies and avoiding even worse unintended consequences. So basically, as long as the Inflation Reduction Act is a law, whoever is in the next administration still have to implement that law and pass those savings on to seniors. So next year, I will be keeping my eye very closely on what's going on in the medication space. So I'm encouraging you to subscribe so that way you can stay up to date as well. And hopefully Medicare will continue to move in the right direction. I think it's a great program and it's very helpful to many seniors. Let me know what you think in the comments. Thank you.